So what I just want to sort of, wrap up the day and apologies to some of you who were here yesterday, and there'll be a bit of a repeat dose of some of the things, but to be honest, I think some of it bears repeating in terms of what we're doing with our strategy and things. So we are really trying to make a difference. We've developed new strategy, and I'm going to particularly give a little bit of information and videos on our campaigns. So we held, we meaning the board and senior management, we held a strategic planning retreat a couple of months ago, and which was really quite a watershed moment for us as an organisation. It's been 5 years since the national office was established. I've been on deck nearly 5 years. Claire's been there just ahead of me, and so we've really built the organisation, as I like to say, from pretty much a volunteer-based organisation right through now to a multi-staff national office. And so the board had felt that it was time that we really take stock of what we're doing and where we're going in the future. And so this strategic planning retreat was a pretty significant event for us, and we thought that going into it, but coming out of it, we are even more impressed with how significant that was for us. So as part of that, what we developed was a new vision statement. We hadn't really had a vision statement in the past, or there'd been various statements floating around. And so this is what we came up with, and it was a collective thing. We did quite a lot of workshopping with a facilitator on eliminating death and suffering from prostate cancer. And that might sound pretty bold, pretty ambitious, but that's really what we see as our vision. It's something that we want to put out there. To what level we achieve it, time will tell, but certainly through the research, maybe we can do something to eliminate ultimately death so that prostate cancer becomes simply a treatable illness rather than a death sentence for many people. And certainly we can do something to eliminate or reduce the suffering from prostate cancer. And that'll be achieved through our mission, which is essentially picking up the strategic objectives that we had in our previous strategic plan. And it's very similar to what you just articulated, Steve, that you do there: promoting awareness, providing support, funding research, and advocating for patients. It's really like 4 pillars, if you like, of the activities that we're involved in. And then we went on to talk about the sort of values that we want to hold as an organisation. And I guess these have been sort of intrinsically just that we've had anyway, but we wanted to actually identify them and nail our colours to the mast, if you like, and sort of say, so this is what we're about: enhancing mana. So we're engaging people with respect, dignity, and integrity to build relationships of trust. Relationships, in my view, are just such a key factor in what we do. For me, it is foremost in my role, the relationships that I have with you people who do so much work for us, the relationship that I have with the board. I believe in maintaining a very healthy relationship with our sponsors and with our supporters, and with those that we're trying to work to change through the political scene or through the medical environment as well. And so relationships are very important. And then it's about empowering people among our staff, among our support group coordinators and volunteers, and the people that we engage with. And certainly through the community, through the people who are living or dealing with prostate cancer in their lives, empowering them to make informed decisions about testing and about treatment and care. It's also about good stewardship. As an organisation, we have to raise every dollar that we spend, and so we're really cautious and careful about how we spend it. And sometimes it might look like things are a bit flashy in that, but you can be assured that we've gone through a pretty rigorous process before spending large chunks of money. And then community service, serving the whole community. And it goes back to what Barry was talking about this morning, about the equality, and trying to treat people with respect, but irrespective of ethnicity, culture, or location. So now just to get on to talk a little bit about our campaigns, and as you will all know, Blue September is our big campaign of the year. And what used to be running for a month and about a month or two's organising beforehand really is now a 12-month process. We have already begun meeting with our sponsors and with our agency and are well into planning this year's Blue September campaign. We will be meeting again formally with all of our sponsors as a group. We get them together for a morning tea and a roundtable meeting in June, and we'll be laying out what the campaign is, and we'll be looking to get their ideas of how they're going to implement it, and then we'll be working with them sponsor by sponsor to see them engaged and see them delivering on it as well. So Blue September for me is an absolute priority. What happens in September is that lots of charities come out of their winter hibernation. And so there's a number of charities that sort of become active in September, springtime and all that sort of stuff. But we're Blue September, and for my mind, we've got to be the brand leader of the charities out there in September, and so we work pretty hard to do that. We've done it now, I think it's 10 years that we've been doing Blue September, so it is very well established. And so I'm talking about last year's Blue September campaign, and which a similar one is going to roll out this year. But we developed this whole new idea, have a blue do, and join the fight against prostate cancer. And so this whole idea of Blue Do really caught on, and you can see the list of our sponsors across the bottom of the poster there. They all bought into it and got enthusiastic, and we had a lot of fun. Jason Gunn was enlisted to help us out, and he's a fun person to deal with. And when I first rang him and said, Jason, would you get involved? He said, sure. He said, my dad had prostate cancer. So we immediately, there was a connection established there. We didn't know that ahead of approaching him. And so we developed this whole new theme about getting involved with a Blue Do and joining the fight against prostate cancer. We did a very interesting market research project to give us some facts and figures for the public relations part of our campaign. We felt if we could go out with some statistics, with some comments and some feedback about what we'd discovered about men's attitude to prostate cancer and to Blue September, we would have some good stories to tell in the media. And that certainly happened. I did a number of media interviews based around the research that we've published. It wasn't really highfalutin research, it was just sort of at a market research level, but nevertheless it was pretty effective. And so it ended up with about 1,100 Blue Do events nationwide. It raised nearly $1 million. And Claire puts up some stats yesterday. I think we engaged something like, Claire, correct me, 26,000 people or something like that were involved in a Blue Do event through September last year. So overall, it was an incredibly successful campaign, and we were very pleased with it. Radio and TV is a really important part of it, as is social media. And through social media, there was a reach of over 1 million impressions. We use billboards, we use in-store screens. You know, you go into the petrol station and they have a LCD screen up there with messages going across it. You go into the medical centre, they've got them. So there was about 800 screens nationally that we were displayed on. And we also had two new companies join us as sponsors, VTNZ, with their big network of testing stations nationally, and Bauer Media, who run a lot of the magazines like the Women's Day and some of those popular magazines. They joined us, and so we got some really good coverage in the magazines from them. And then we developed a new major event, Pedal for Prostate, which we really hope will be our signature event. And this was a cycling event out at Hampton Downs Raceway. We had about 108 or 109 riders in that. It was really like just a sort of a trial for the first year, and it raised $85,000 in the day. So that's going to happen again this year. It's going to be bigger and better. Mazda were the main sponsor of that. And quite a unique experience for cyclists to get out and ride on a motor racing track with no cars to fight and big wide sweeping bends and a few hills and undulations as well. They loved it. Bikers in Blue is the motorbike rallies. You'll see that on the video in a minute. And Bet on Blue was a big gaming night that we held at Sky City Casino, all with play money, I might add. And we had about 300 people there, and that raised $85,000. So it's pretty active, it's pretty busy, but that's Blue September. So we moved from the sublime to the ridiculous, really. So for the first time last year, and we've just repeated it this year, we did a testicular cancer awareness campaign, Go Balls Out. And we realised that International Testicular Cancer Awareness Month was in April, and so we'd planned it. And so we were keen to do something, and then a great idea emerged. We were approached by FCB, which is a big advertising agency in Auckland, international agency, and they had come up with this great idea. We'd been wanting to use Aaron Cruden, the former All Black, who's a testicular cancer survivor, and his agent had some connections with the agency, so came to us and said, here's an idea. We went in there, we sat down, and they, as agencies do, they do this big pitch, this big presentation to you. And Claire and I are thinking to ourselves, hell, what's this going to cost us? And then they turned around and they said, well, we'll do all this pro bono. You know, you guys pay for the delivery of it, through the media costs and things like that. And they did all the creative and all the concept and much more. And so that was our first venture into testicular cancer campaign.
The cock and balls. Men have been doodling them for ages, but we put them to a better use. We use them to save lives. Testicular cancer is the #1 cancer for 15 to 39-year-old males. But these young guys are completely oblivious to it, and the fact that exercise can help prevent a number of cancers, including testicular cancer. So with a little help from this wee shape, we got them out sweating.
Testicular Cancer New Zealand is launching its provocative new, quote, Go Balls Out campaign for World Testicular Cancer Month.
And it encourages men to exercise, as exercise is the best thing you can do to help prevent many cancers.
It's sort of awkward to say this now, but they run in the shape of a cock and ball.
You heard that right. They want you to run in the shape of your package.
Go Balls Out, a socially led exercise challenge that put testicular cancer on the map, literally. It got young guys to be the campaign, helping themselves through exercise, and their mates too. The challenge caught on as guys competed to work out the best willies. We saw big, small, curvy, and whatever this one is, they walked, kayaked, and even flew. Cheater. We put the finest phalluses on display and fed the very best specimens back into the campaign. Nice. We also used a cheeky chatbot who helped find a route nearby. Outdoor and cock by numbers events in local parks got even more people pounding the pavement. We also taught guys how to check their ghoulies for the disease too. The moment we launched, doodles popped up all over the world, and media, who usually shy away from dick news, embraced it head on.
Radio Live. In breaking news, giant penises are appearing like crop circles all over the country.
Thanks to this wee guy, we grabbed hold of a group we desperately needed to reach, with a campaign that got guys out doing the very thing that can help with cancer prevention. Just ask Chris. Go Balls Out.
So there it was. And as it said there, it reached 194 countries. The little video, self-checking how to do it video that they made, which was a cute little thing around the street map theme, had over 4 million hits. And so it was, and it was quite unnerving getting a phone call from Spain to do a media interview with a radio station in Spain. Not to mention the local one. So that was last year. This year it didn't go quite to that level, but it certainly reinforced what we've been on about. Support services are a really big part of what we do, and many of you folk are part of it. We've got 34 support groups, the online support forum, a patient welfare fund for folk who need some assistance coping with disease and treatment, helplines and patient education forums. All are really a key part of what we do. And then funding research, and we've mentioned several of those today. It's a pity that Billy was unwell today and not able to get here, because we funded this study on to try and get some data on Pacifica men. We really don't know what's happening in the Pacifica community. The statistics that the Ministry of Health puts out breaks it down into Maori and non-Maori, and so we really don't have much other ethnic detail And so that the study that they're working on that will be valuable. You've heard from Trish talk about the training program. You've heard us talk about the PSMA and the lutetium treatment studies, and also the study grants that we issue that Trish actually didn't mention today, but we've been funding a couple of nurses to get through to higher level qualifications as well. Advocacy is an important part of what we do, and that falls a lot to me and also to Mark, covering off with pharmaceutical companies and with Pharmac for new medications. We're currently working on enzalutamide and cabazitaxel to try and get those available here to men in New Zealand. Advocacy on behalf of patients when things aren't going well within a DHB or through a GP clinic or something like that. We're trying to get some engagement with the Royal New Zealand College of GPs regarding greater coverage of the guidelines that were established that Mark talked about this morning that were established in 2015. And also we've got a group together of urologists that we're starting to put together. Pitcha Madu just alluded to that earlier on the panel for ED medication and treatment. And we've had representation on the prostate working group and the Coupe project, which is this decision support tool. And I'm just going to show you now just a little video that promotes this Coupe video. So we think this is a really great tool, and we'll be certainly promoting it through our website and through our interaction with the community as well, to try and get men engaged in going through that and assessing their risk and whether they need to get a PSA test or treatment options and things like that. So that brings us really to the end of today. It's certainly been a pleasure having you all here today, and I just want to say a few thank yous. First of all, I want to thank the sponsors who enabled this day to happen, Lion Foundation, Janssen and AstraZeneca. We receive a good dollop of financial support from each of those organisations that helps us keep the cost right down to a minimal level so that there are minimal barriers to entry so that people can get along to this conference. And so we really appreciate their support in that. And I also, again, just want to collectively thank the speakers. I know most of them have gone by this stage, but to thank them for giving up their time. It's a Sunday after all. Many of them work long hours, during busy weeks, and to give up their time. But I think I appreciated to hear from a number of them today their appreciation of the work that we're doing, and we're very much in a partnership with them in supporting their patients. I particularly also want to thank our staff. They've done a fabulous job in getting us this organised over the months, and then the logistics of getting it done in Wellington. So would you please join me in thanking them?